Blaine, the other day this was actually several days ago. This was when my son was much younger. I picked him up one day and I took him and I reached out like this and placed him in his high chair. And almost immediately, about the middle of my back, right about here, I felt a little bit of pain, a little bit of tinge, and it took me about 2 or 3 days before I fully recovered. How do you handle that?
So that's probably some type of strain of your thoracic spine or your mid-back.
Mm-hmm. All right.
That's a kind of a loaded question, but
a loaded question. Yeah. It did turn out to be the thoracic spine, and it was kind of painful, but it was something that I actually was able to do some self-treatment on, and I was fine after a little while.
Yeah, it often does heal up on its own, or with some stretches and some things that we'll talk about today.
Yeah. All right. Well, if you didn't already know, I'm Greg. This is Blaine from Recover Physical Therapy. We're going to be talking about thoracic spines today. Okay. So first question that we would want to answer is, what is the thoracic spine? I, again, lay member of society, not very familiar with certain parts of anatomy.
So that's okay. So your thoracic spine is basically your mid-back. So maybe if you want to turn and this part of your spine is your cervical spine or your neck. Your thoracic spine runs from here to about here, and then your lumbar spine runs from here to about here. So we're talking about pain in this mid-back area. It's called your thoracic spine because all of your vertebrae of your thoracic spine are connected to ribs, so that makes up your thorax. And your thoracic spine is it's quite a bit less mobile than your cervical spine or your lumbar spine because it's attached to the ribs. So it protects all your organs, your thorax does. And there's not a ton of movement in there, but it does need to move well. And if it's not moving well, it can get your attention really quickly.
Oh yeah, you got my attention really quickly on that one, I can tell you. And it's over a decade now, but I still remember that pain, so
yeah,
that's a good one.
And there's various problems that can happen in the thoracic spine. So, you can injure a disc in your thoracic spine.
Mm-hmm.
It's much less common in your thoracic spine than it is in your neck, in your cervical or your lumbar spine, but it can happen. And since your thoracic spine interfaces with your ribs, sometimes those articulations between your thoracic vertebra and your ribs can become painful.
Yeah. We'll have another video on that because we were talking a little bit about rib dislocations and stuff like that and how you handle that, but that's for another video.
Sure.
So just to kind of help you understand what my self-treatment was, I iced it a lot, and then 2, I just rested it for a couple of days, and I was surprised at how quickly, and maybe this is a normal thing with your spine, that if you just rest it, it often can return to normal pretty quickly, but I don't know.
In the acute phases, yes. So if it's just been a day or 2, it's generally okay to rest. You do want to be careful not to rest too long because if you rest more than is appropriate, then that can come back and bite you too. So after you've rested and you get rid of that acute pain, the really sharp pain, there are certain things you want to do to start getting moving and strengthen it back up again.
And those are the things we're going to be talking about, I'm guessing.
Yeah.
All right, cool. Anything else we should think about before we dig into doing some exercises and helping everyone look at this?
No, I think it is really important to keep the thoracic spine moving well. A lot of times when people have pain in their neck, that's often a problem due to stiffness in your thoracic spine. So keeping that mid-back mobile and moving well can help keep your neck feeling good too.
All right, well, let's get to it.
All right. A really good mobility exercise for your thoracic spine is called thread the needle. So you'll be in all fours in quadruped position like Greg is demonstrating. And you thread the needle by reaching one arm through, and then you reach all the way back up towards the ceiling. And you can kind of turn and look up at your hand as you look up. And you go back and forth. So it's good to start with about 10 of these on each side. And so this is a really good exercise for other things too. It's good for your shoulders, it's good for your neck. But this really forces that thoracic spine to be mobile. So you want to make sure you do this on both sides. And a lot of people, when they first do it, will notice they're more mobile on one side than the other. And if you find that's the case, then that's just a cue to work on that stiff side and try to limber it up so you're a little bit more symmetrical.
And you will feel injuries if you got them, probably.
Yes.
Is it anything that's connecting to the spine, I would imagine?
Yeah. That
I feel the hip.
you can feel it in your hip too, yeah.
Yeah.
It rotates a little bit of everything. The next exercise is also performed on all fours in quadruped position, and it's called the cat-cow exercise, or some people call it cat-camels. So you're going to arch your back up in the air like an angry cat does when it's angry or scared, and then you do the exact opposite, and you drop the spine down, and you just arch it up into a kind of a convex position, and then you drop it down into a concave position. So this is a good thoracic spine mobility exercise and a good stretch.
You always feel good doing this.
Yeah. This one is also often recommended for people with low back problems because it can be good for that too, because you're kind of controlling your pelvis a little bit as you into anterior and posterior pelvic tilt. It's a foam rolling technique. This cylinder-shaped foam roll Greg has in his back, so he can put his hands behind his head, just really arch backward like so. And what that foam roll does is it forces his back, it kind of functions as a fulcrum and forces his back to bend wherever the roll is. And so you can do several repetitions of this and then adjust the roll to a higher or lower level. And you want to hit all different regions of your thoracic spine. And that'll get some good stretching and good mobility in all different areas of your spine. This is just a more advanced version of the one we just showed you in the chair. It's also a foam rolling thoracic extension technique. And so you can put that foam roll under your thoracic spine and arch backward. And then you can kind of adjust either your body or just the foam roll and move it up and down your thoracic spine. And that just uses the fulcrum, the foam roll to bend you back in different positions. And that's a fairly intense stretch, isn't it, Greg?
Oh yeah. And you're gonna feel things pop. My goodness.
Yeah.
Just about anything. Like you when you were demonstrating it earlier, you were popping.
Yeah, you'll often pop in this, and it often feels kind of good.
It does feel
It's a
good.
nice, gentle way to pop your back without any, aggressive thrusting techniques.
Yeah,
So,
I like that.
so that's a good one to spend several minutes on and just do several repetitions at each level, then move it up and do several more repetitions, and that's a really good way to mobilize your thoracic spine.
I like it. I like it. Yeah, you'll feel good after doing these and the stuff on the chair.
Yeah, they do feel good.
Yeah.
They kind of bend you in a way that you don't, typical normal people don't bend that way often through their normal daily routines.
Yeah, or you're hunched over a computer or something like that. And
Sure. Excellent posture exercises. Yeah.
cool. What's next?
Yeah. So you'll be opening the book like
So
so.
it's like this.
Yeah. So this next exercise is called Open the Book. And so you half kneel on one knee against the wall. So your knee closest to the wall kneels down, and then your arm closest to the wall just stays there, while your opposite arm rotates a full 180 degrees. And you feel a pretty good stretch on this one, don't you, Greg?
Yeah. There's probably you probably feel your form on this one too.
Yeah.
You have to have probably have good posture with your back on this one, I'm guessing.
Yeah, it's easy to get sloppy on this one. And this is also an exercise so if you have maybe an elderly person, may not be able to kneel down and do this. You can also do this in a standing position, just standing against the wall, and then just try to keep your hips from rotating too much if you're standing. When you're in the kneeling position, your hips are not going to rotate that much, so that kind of forces your thoracic spine to bend.
Yeah.
And then you can, of course...
There's another one. Oh, sorry.
Oh yeah, and so you'll do this on both sides. Next one is a very advanced mobility exercise. So you'll kneel down with your side facing the wall, and then you rotate your shoulders away from the wall, facing away, and you're just going to tip sideways left to right like Greg is demonstrating. And you can probably tell that this is a fairly challenging exercise.
Yeah.
This will really force you to move in ways that you're not used to moving your thoracic spine. You doing okay?
Yeah. This actually feels really good, but it's not an exercise I would normally do. So.
And then you can reverse that. So you'll stay kneeling on the same knee, but this time you'll face your chest towards the wall, and then do the exact same thing facing the other way. And again, this will stretch you in ways that you're probably not used to.
Wow. Okay. Yeah, I like that.
And then you can, of course,
Switch knees.
Switch to the other side and turn around, and then you do the same thing. And again, I don't know if you wanted to film this, but it might be good just to keep you symmetrical here.
Yeah.
So here he's doing it on the other side. So firstly with his back towards the wall, leaning side to side, and then after you do about 10 or 20 reps of that, you'll flip around and face your chest towards the wall and do the same thing on this one. That's not hurting you, is it, Greg?
No, but that's a pretty intense stretch, actually.
It is, yeah. This one might take a little bit of working up to.
Yeah, I might have to do this one more often. So
You actually demonstrated it very well for being your first time.
okay.
So you're probably more mobile in your thoracic spine than I am. So for this exercise, Greg is demonstrating a rowing machine. So a rowing machine is a great tool for the upper back and for the mid back, the thoracic spine. And it's a common piece of cardio equipment that you'll find in people's gyms or home gyms. And there's a few different ways you can do this. You can use a rower machine like this, and this was more of a low resistance cardio type exercise. You can also do this with a high resistance on like a cable machine, or you can do like inverted push-ups where you're hanging from like TRX straps, or we can demonstrate that, or hanging from a pull-up bar with your feet propped up, and you can pull your body weight up that way. So those are both really good ways to strengthen the muscles in your shoulder blades and your thoracic spine. And I would recommend doing that for anyone, or using a rowing machine for anyone with thoracic pain or with people who are concerned about their posture.
Or if you want to, you can do them from a jungle gym. We had that discussion before we left. But that's how I do mine. I get on a jungle gym and I hang upside down from it.
It totally works. And we can even demonstrate that with the TRX straps, or a similar version of it.
Yeah, we should do that.
So here's an example of a more higher resistance row. And so you can use some suspension straps. These can be purchased online, or a lot of gyms will have them. You can also, like Greg was mentioning, you can go hop on the monkey bars at the jungle gym and prop your feet up on some of the foot rungs while you do this.
Yeah.
But this is a great way.
That one can cause a fall though pretty quick if you're not confident in yourself.
Make sure you have a good grip strength before you do this one, yeah.
Yeah.
But there's several different variations you can do, and this is a great way to strengthen your mid back. This is kind of the opposite muscles that you're using when you do push-ups, so it's like an inverted push-up. And so a lot of times people will have not a strong chest from doing push-ups and bench press type things, but they won't have good antagonist muscles developed in their back. So this is a great way to develop the opposite muscles as well. And it's a bit challenging, isn't it?
Yes, it is a bit challenging. So just be aware, that one will probably wear you out pretty quick.
Yeah. So you can adjust the angle on this exercise. So this one, Greg, is not at such a sharp angle. So you can start standing up fairly vertical and not going quite as far back. So this is a better beginner's way to do it. Just make sure your feet are well placed and they don't slip out from under you as you lean back.
Well, Blaine, every single time we do any of the back exercises, I always feel like this is a neglected part of my own personal workout regimen. What's the long-term benefits of something like this? Of doing thoracic or any spine workout?
Yeah, there's a lot of benefits. Keeping your spine strong, it can improve your balance. So when you get older, you're more likely to have good balance if your spine is strong. It helps with your posture so that when you're 80, you're not walking around like this.
Yeah.
And it decreases the chance of having injuries in general.
Okay. So, we were mentioning off camera about how doing some of these exercises with Blaine has actually helped me improve my workout regimen, and the rows is probably one of the bigger ones that I really started doing that I hadn't done before, and I've noticed a significant improvement. So if you're thinking about recovery, I would highly recommend you focus on some of these exercises, especially in something like this, where we're talking about things that most people won't spend their time on. So.
Yeah, there's really so many benefits to it. It's also good for your heart, it's good for your brain, it's good for everything.
Yeah.
And you may need to start kind of gentle, so you might not start with real high resistance or for a really long time, but even if you've had an injury in your thoracic spine, most of the exercises we just demonstrated can if you ease into it gently, they can be completed without flaring things up.
Like the cat cows and
Sure.
the what was the other one? The thread the needle.
Yes.
That's awesome. Well, thanks so much for giving us this advice this week, Blaine, and we will catch you guys next week.
Happy to do it.